I'm Bobby Asgar. COVID-19, the cold hard truth. COVID-19 spread seems to have slowed in China, but only because of China's response to the virus. The UK and the US are not China. The People's Republic of China is a one-party socialist republic. In China, the governmental methodology is to maintain a tight grip. A brief summary of COVID-19's timeline is as follows. December 31st. Several people in Wuhan report symptoms caused by a virus that is later tied to an animal and seafood market. January 7th. The cause is identified. The virus is labelled 2019 nCoV. January 9th. Chinese officials report the first COVID-19 related death. January 13th to 15th. Thailand and Japan become the first countries outside of China to report international exposure. January 21st. US officials confirm a resident in Washington state is infected with the virus. January 23rd. Wuhan, a city of over 10 million people, is put under quarantine by the Chinese government. Similar bans quickly follow suit in other cities in Hubei province. January 24th. Just 2 weeks after the virus was identified, its hospitals overwhelmed, China initiates the establishment of 2 1,000-plus bed facilities. January 27th to 31st. Neighbouring countries close its borders with China and shut down schools. Travel suspensions are announced worldwide. Air traffic with China is shut down. The World Health Organization declares a coronavirus outbreak a public health emergency of international concern. Italy declares a state of emergency, the first EU country to do so, and allocates an initial €5 million to tackle the virus. March 11th. In over 110 countries, 120,000 people have been declared infected. The number of infections undeclared and undetected potentially increases that number by a factor of 10 to 15. The World Health Organization declares COVID-19 a global pandemic. March 12th. Ireland closes its schools, universities and childcare facilities. The UK, however, announces its movement from containment to delay. The British Prime Minister advises self-isolation to slow the spread of the infection. March 14th. More than 3 months after the virus was first identified and 6 weeks after the World Health Organization declared the virus of international concern, 150,000 people have been declared infected, with the potential of the true number being as many as 2 million. There have been 5,600 fatalities. A further 5,700 are critical. In the US, Gloria Gaynor sings "I Will Survive," and the US President declares a state of emergency. The truth is, neither the US nor the UK have the facilities nor the infrastructure to accommodate an outbreak of such proportions. It is true the spread of COVID-19 has slowed in China, but only because of China's governmental structure allowing for the enforcement of a rapid and vigorous response to the outbreak. Make no mistake, COVID-19 is still active and widespread. The EU, the UK and the US, however, are not China. Their governments function with different tact. Especially in the UK, it seems the plan is to sit tight and see what happens next. If the virus is slowing in China, hopefully it will slow in the UK. It very much sounds like an ostrich sticking its head in the sand. Europe is now the epicenter of the virus. Italy is on lockdown. Spain is rapidly following suit. Our only weapons are face masks, antibacterial fluid and self-isolation, and governmental advice, to date, has been to focus on the latter. With no cure, the UK's delay phase effectively amounts to the population being on their own. The UK and the US are not China. It feels like their governments are dragging their feet. I sincerely hope this isn't the case. But if they don't act now, rapidly and with far greater force, I fear COVID-19 will overrun both with far more devastating effect. I'm Bobby Asgar. Remember, be prepared, keep calm, and please, use caution.